Welcome to VetMed 529A, Aquaculture and Aquatic Animal Medicine. Today, we will be dissecting a fish, specifically of the species Chanos. Introduction.
The milkfish or the Bangus is the sole living species in the family Chanidae. However, there are a list of 5 extinct genera of Cretaceous. The repeating scientific name is from the Greek word Chanos. The species have many common names. The Hawaiian name of the fish is Awa, and in the Tahitian it is called Ava, and in the Philippines it is called Bangus. Milkfish aquaculture first occurred around 1800s ago in the Philippines and spread in Indonesia, Taiwan, and into the Pacific. Traditional milkfish aquaculture relied upon restocking ponds by collecting wild fry. This led to a wide range of variability in quality and quantity between seasons and regions. The characteristics of milkfish are spindle-like shape that is moderately compressed, smooth, and streamlined. Its body color is silvery in the belly and sides, grading the olive green or blue on the back. Milkfish is an extremely bony fish. Its white meat has a mild flavor that makes the fish good for a variety of cooking preparations.
Be sure to have the following supplies: latex gloves, goggles, scalpel, scissors, forceps, and probe. Today, we will be dissecting the fish Bangus. As we proceed with the dissection, please refer to this diagram as a reference. The first step is to assess the specimen in situ without cutting the carcass. By doing this, signs of abnormalities can be observed. From close up, the actual physical manipulation and examination of the various organ systems commences. In the external examination, it is important to be oriented with the positioning of the specimen. The anterior, posterior, dorsal, and ventral positioning, along with the external parts of the fish, should be familiarized.
First, let us identify the external parts of milkfish. Number 1 is the head. The head of the Bangus contains the eyes, mouth, and gills. Next is the body. The main body of Bangus is elongated and somewhat torpedo-shaped. Next is the fins. The dorsal fin is located at the back of the Bangus. The dorsal fin helps the stability and maneuvering through the water. The anal fin is positioned on the underside of the Bangus near the tail. The anal fin also assists with stability and steering. Next is the tail. The tail fin, also known as the caudal fin, helps propel the Bangus through the water. Lastly is the scales. The scales of Bangus are small, silvery, that covers its body.
Examination of the specimen's mouth. This is done by placing a probe in the specimen's mouth and gently pushing it through the operculum. Several gill arches can be seen when doing this examination.
The eye of the Bangus is covered by a fatty outer corneal layer called the adipose eyelid.
Let's proceed to the internal examination of the specimen. First, make an incision along the dorsal side of the fish no higher than the lateral line. Most of the organs resides in the ventral half of the body, so be careful not to cut too deeply. Using a scalpel, make an incision towards the head. The second incision should be given on the ventral surface just forward of the anus. Upon reaching the gills, cut upward behind the gills. This will complete the third incision. Lastly, finish the process by making a fourth incision. Very carefully lift away the cutted section of the body wall. Using a scissor, remove any membranes that adhere to the body wall. If the body organs are covered with fat, forceps can be used to remove this material. After the removal of the body wall and the membranes, internal organs can now be located and identified. To identify the digestive system, find the tan-colored liver with the gallbladder attached to and underneath the liver. Cut the liver free from the body to expose the esophagus and stomach. Then trace a route. A piece of food would travel as it passes through the fish's digestive system. Find the mouth, pharynx, esophagus, pyloric ceca, stomach, intestines, and anus. To aid in locating other organs, remove the entire digestive canal by cutting it free to the anus and at the mouth. To locate the reproductive system, determining can be done by locating either a pair of testes, which is a small pale yellow mass on the ventral side, or a single large yellow ovary filled with eggs. The testes and ovaries are connected by tubes to the urogenital opening found posterior to the anus. Respiratory and excretory system. Locate and remove the bright white, gas-filled swim bladder in the dorsal portion of the fish. On the dorsal wall of the body cavity, locate the kidneys. The kidneys are connected by urinary ducts to a urinary bladder from which waste pass out of the body through the urogenital opening. Lastly, we have the circulatory system. Cut through the fish's body anterior to where the liver was located. Doing this exposes a cavity where the heart is suspended. Find one thin-walled atrium and the one thicker-walled muscular ventricle. You may be able to locate one enlarged vein, the sinus venosus, where blood enters the heart, and one enlarged artery, which is the bulbus arteriosus, where the blood leaves the heart. The blood leaving the heart goes to the gills, where it flows through capillaries in the gills and throughout the body in various veins and capillaries and arteries, and finally returns to the heart to be pumped throughout the body again. This concludes our video. Thank you so much for listening.